what happens with a knee that has arthritis in it is, you start to lose some of that kind of cushion in there. Mm-hmm. And so the bones start kind of bumping against each other, and that causes some inflammation. Mm-hmm. And what happens with that, the body thinks that it can help that by sending more blood flow, but actually more blood flow makes worse inflammation. So it doesn't really help itself very much, but it thinks it's helping. So sometimes what can happen is you have normal arteries. There's arteries that supply your knee and around your knee, but they develop these extra little tiny, almost like little hair-like arteries and little blood vessels that are kind of inside the knee to try and help with the inflammation, but they're actually making the inflammation a little bit worse. And so what this procedure does is we basically close down some of those blood vessels. So it's been used for a long time for, sometimes after someone has a knee replacement, they have surgery on their knee, there sometimes can be bleeding afterwards. And so this procedure was used to block those blood vessels to stop bleeding. But what people noticed was that it also greatly helped their pain pretty quickly. So then they started studying that, and they found that it actually works pretty well to stop pain. So generally what the studies show, and your disease based on your x-rays are kind of at we grade them from 0 to 4. You're kind of at a 3, leaning a little bit towards a 4 on the right.
I wouldn't doubt it, because it's gotten worse.
And so the studies have shown really good improvement. They haven't been studied as much on 4s, but 2s and 3s have been studied a lot. And so what they found is about 80-85% of people will feel better after the procedure. Their pain will be diminished, generally by about 50% at 1 month and 70% at 3 months. So it sort of, it doesn't like that right away, but it sort of gets better over time. And we've kind of followed people out for about 2 years, and people still feel better at that point. Occasionally they'll start to have some pain, but it's, maybe 1 out of 100 will start to have some pain at 2 years. So it works pretty well. It's very less invasive, obviously, than having a knee replacement, right? So what we do is we go through a blood vessel in the bend of the leg here, where it's easily accessible, and go down with a little tube, and we inject some contrast so we can kind of see what the blood vessels are doing. And we can see that it's called a blush, where you can see all those extra little blood vessels, and we use some particles to block those off, leaving the healthy blood vessels working and just getting rid of those new ones that your body made to kind of block that off, and it helps decrease the inflammation. There's just a little stitch that goes in this little hole here. We do it with just some sedation. Technically, some people have done it completely awake. They don't really, you just numb the skin here and put that needle in. You don't feel anything inside your body. The only thing you may feel is when we inject contrast. Sometimes it gives you a warm feeling, like you'll feel your thigh get kind of warm. But otherwise, it's very easy procedure to do.
That's great.
Yeah.
Because I don't want to be under.
Yeah,
right. No, close to it.
No, we don't go under. And the sedation is, like I said, people have done it awake. Sometimes people just for anxiety to kind of relax a little bit, will give a little touch of something just to help you relax. It's done in the clinic. Dr. Frank is our doctor who does it. He's an interventional radiologist. All he does is do blood vessel things or work inside the blood vessels. Generally, the procedure takes 1.5 to 2 hours or so, and then we keep you for about an hour or 2 afterwards just to make sure you feel okay, and you go home. Really no big restrictions on you afterwards. We do actually, the only real thing is being careful with this little puncture site that we did here. So avoiding real strenuous things with the legs, lifting, a lot of work with that leg, just to kind of, showering's fine afterwards. We don't soak in water though for a few days, just until that heals. Risks are pretty low, very low actually. The biggest thing that we've seen, which isn't so much a a scary complication is sometimes people can get a little discoloration in their skin. Their skin can kind of turn a little bit darker color for a short time. That's usually transient and it goes away. Other things are all less than 1%. Bleeding because we made a little hole here, infection because we made a hole, being allergic to the contrast. Have you ever had contrast before, do you know? For like CAT scans or anything?
Yes, she did, and she had a bad reaction.
What was that?
Oh.
They were doing a test on you for your heart. You went in for that procedure and you died.
Oh, yeah, okay, Oh, yeah, she was, now I remember. It's good I got her
I
along.
know. Always good to have a second set of.
Yeah, what was it?
Yeah, they injected the dye and then they left her in the waiting room and she totally flipped out. And,
yeah, I died right on the floor in front of my husband.
Yeah.
Okay. Were you, so it was a heart test, huh?
Mm-hmm.
Okay. Did you have to go to the hospital?
I think I stayed
in the
overnight.
hospital.
Oh, you were in the
Yeah,
hospital.
yeah.
Okay.
Well, they took me over there. Oh, this was, it was at the.
Yeah, broke her sternum.
Yes, they did. Broke the ribs.
Okay.
I had a little.
How long ago was that?
Good question, huh, Mom?
Yeah, I see time from nowadays is just hard to
Oh,
realize.
between 5 and 10 years ago?
Yeah, it would be.
Okay.
I can look it up though and let you know the correct thing.
Okay. In what hospital were you at?
In Fargo.
Sanford?
Yep, Sanford and Fargo.
Sanford and Sons?
Okay. Okay. Yeah, I would have to check maybe to just see what kind of contrast that is. There are different kinds for different types of tests that we do, so you might want to check that out just so before we give you any
I'm
contrast.
allergic to geniculate, and I think I wrote that in the one on this. Yeah.
Somewhere. I can find the right page.
Plavix and geniculate, yeah, those are the two.
Okay.
And I really got sick. I got fever
Mhm.
and ended up in the hospital for a day or so.
Okay. Were you on that? Did you have a stent or something in your heart, or?
Yes.
Mm-hmm.
Okay.
Let's see when that was done. I don't know. The early 05, 6, 7.
Yes, it was 05.
Is it? How do you know that?
You read it to me last night when you found this paper that you had all the information on. And because we wrote on the form 2010, and you went, oh, nope, it was 2005.
Okay. Okay. All right. Any chest pain or chest pressure or anything recently?
No.
No? Okay, good.
Once in a while I'll wonder what's the matter with my heart today. But I don't know if it's stress or what. I don't have stress though.
I know, you don't do stress.
You don't do stress. That's good. That is very good.
Walter G. said that.
Is that what
My father-in-law
Oh.
said. And he was living with a woman that was constant stress, pretty much. Okay. He says, I don't do stress.
I don't do stress.
I don't do stress. That's good. That's a good thing for every part of you. All right. Well, what questions do you have on that?
So it'll take about 3
You're in the
4
clinic
hours.
about 4 hours or so. Yeah.
Okay.
And it's an
Yeah.
outpatient.
It's outpatient. Yep. Yep.
And what does Medicare take care of it?
Yep. They do.
They do.
They
I
do.
was wondering about that.
Yeah, they do. As long as you meet the, that you have pain that makes sense for it. You've tried other things like injections. They usually want you to have tried injections before.
Oh, I've tried them. Yeah.
And then that for some reason you either can't or don't want to have a knee replacement.
Too old. I wouldn't want to be put under. Okay.
Yeah.
I don't know if I have any other questions. Do you have anything?
No.
How
Sounds
soon
like
is
it'd
there
be
an
pretty
opening?
easy.
Yeah, the only thing I'd wanna check on is that dye, the contrast dye situation, cause we do have to give you some contrast for this. And often now we pre-treat people with some steroids and some like Benadryl or
Okay.
antihistamine for contrast allergies, but you might wanna just check, I might wanna just check on that. We can probably get that information from Sanford. Or I may have to have you sign something, but
Oh, yeah.
Yeah.
Well, I don't know, they've got, I don't go to
unless it's
Sanford
a
very
long
much.
time
I
ago.
go,
Yeah,
I'm from Crookston, closer to Crookston,
yeah.
so I doctor there.
Yeah, but they should have that record. Cause, you know, when you die at places, they usually,
They like to keep those.
Yeah, I know.
It's usually
I
documented pretty well.
stayed overnight that night, I remember.
Yeah, so you just went in for this test. Was this before you had your heart stents? That's a good question right now. No, it was after.
Mhm.
And so when you had your heart stents, they give you contrast for that. You didn't have any problem with that.
Yeah, earlier. Yeah,
Yeah.
that's when I found out that I was allergic to those two, I think.
Oh, the Plavix and the Ticklate. Yeah. But when they actually did the when they went in your blood vessels and they put those stents in, you didn't have a problem with they give contrast for that too. You didn't have a problem with that.
Not-
that you remember?
not
No,
that
it was
I-
more the medication afterwards. Okay.
I wonder
Yeah.
if they'd have that
Yeah, we can check.
information.
well, you
That's
had
pretty
that done
long
at
ago.
Sanford too.
So that
then.
was Sanford, yeah.
Yeah, wherever your heart issues were.
Yeah, so that was before the other test though. It might have been more of a nuclear medicine test, the second one, so that's different kind of contrast.
Oh, nuclear.
Yeah, I know, nuclear medicine sounds funny, doesn't it? Like PET scans and stuff. PET scans are kind of like that.
Yeah, for
They might have been doing like
animals.
a heart PET scan, yeah.
I don't have any other.
Okay.
Just how soon can we
Question,
get
yeah,
in and
how
get it
soon?
done, right?
Yeah, so we'll let me do a little investigation on that and talk to Dr. Frank, and then basically we just put together an order. We do always check with insurance just to make sure they're on
Good.
board, and then when we get that information back, then Kathy or Amy would call you to schedule.
Oh,
I don't know what his
okay.
schedule is right now. Actually, I don't think it's that far out. I mean,
Good,
maybe a few
Okay.
weeks, but not. I don't think he's that far out. So.
good. That's hopeful.
Yeah.
Yeah.
Yeah,
So-
and we would do one knee at a time. So we'll start with the right because that's the
Mhm.
most bothersome knee,
I-
and then we can either do the right and see how you do, or just schedule both of them. But you might, if the left isn't bothering you too much, you might want to just see how the right goes
Mhm. Yeah,
before you schedule the left.
that makes sense
Yeah.
too.
Okay.
Okay,
Okay. Good.
so.
All right. Sounds good.